We're going to start with counts and estimates. And the first figure that we're showing is the 9,654 people that were counted or surveyed as part of the study. We have two sources of information. There's the providers that do the counts in the shelters and transitional housing programs on the night that we actually do the survey. And they do counts of men, women, and children on those nights. And we survey a very large proportion, over 55% of all of the homeless adults and youth on their own that are in these shelters we interview. But we're able to actually make a count of everyone that was there on the night of October 22nd. This is a couple hundred higher than the count that was released in the press release, if anyone's comparing notes to the press release. Some people do that, I know. We finally, you know, in trying to get all of this data out, we accounted for 200 partners of individuals who were not interviewed and who were added to those final counts. Ellen has been doing some great work with our estimates, using some national figures and other studies to try and estimate what this number is more like if we were able to identify all of the people that were more invisible, more difficult to find. We think it's about 13,100. That is a mid-range estimate. There's a higher estimate. There's also a slightly lower estimate. We have quite a bit of confidence in this number. We think that this is a reasonable expectation of the number of homeless on a given night in November, October 2009. We think this number is likely still true. We're not seeing any changes in the information from providers. This is the rough breakdown of the characteristics of who is in the shelters and transitional housing programs. This also, of course, includes individuals in battered women's shelters. Children with their parents, and these are the children that are not interviewed as part of the study. Children with their parents represent 34% of the total population. Then when we add the unaccompanied youth, I guess I can use this little pointer here. There we go. When we add the unaccompanied youth and then the unaccompanied young adults who are together make up actually a sizable portion, you can see they represent almost half of the total diagram. So half of the homeless in our state, nearly, are 21 or younger. Adult females make up 23%, and adult males make up roughly 30%. Now, it was interesting. Ellen ran some figures for me at the end of the day yesterday, and we were trying to look out, and if we were trying to project for an annual estimate, the actual proportion of males to females is reversed, because females have more short-term episodes, males have more long-term episodes, and so actually, over the course of a year, it's likely that adult females make up a larger proportion of the population overall than adult males. What's new? We're going to break this presentation down into two basic pieces. Information from the shelter survey that represents new findings, and then information about persistent findings that are really significant. We've already talked about the significant increase in the homeless population over the 2006 figures. We'll talk a bit more about that. Decreased employment and income, really a significant issue. Back in 2000, when we did a study, it's sort of a boom economy, we had a time period where 25% of the homeless adult population had full-time jobs. We have sunk from that quite a ways, and of course significantly due to this economic recession that we've all experienced and probably all felt in one way or another. But this is a substantial difficulty if you're trying to get people into housing with rents that they can afford. More homeless for at least 1 year, and I know Laura Cadwell, our Director for Ending Long-Term Homelessness, is not particularly pleased to hear this news. But I think it's really important to recognize the significant barriers. As we've looked at the data and as we've looked at the efforts that have been going on throughout the state and the efforts of many people in this room to provide supportive housing and get people with serious distress into more permanent and stable conditions, we are certain that these numbers would have been worse had we not had plans in place for ending homelessness, for the heading home plans in Hennepin and Ramsey and other counties across the state. We know these numbers would have been worse. But there are, in fact, more homeless who have been homeless for at least 1 year. Also, increased use of food stamps and high use of other services, as we'll talk about in just a minute. And the increase in homelessness is greatest among youth. And so I'll detail each of these findings a little bit. First of all, related to employment, you can see the peak. That 41% represents the number that had any employment back in the peak at 2000. And now we are down to 20% with any employment, and as I said, only 6% with full-time employment. 48% of unemployed have been jobless a year or longer. This is a significant drop from 2006, where 38% reported that they had been unemployed for a year or longer. Similarly, 21% of unemployed individuals in our population identify lack of employment opportunities, and this was 8%. Again, if you're out in the world looking for a job and you're, even if you're motivated, if you have low skills, it's not a good time to look for work. And I know many of the people in this room know that. Median monthly income of all sources, again, a significant drop from 2006, $400 a month was the reported income. The median income reported in our adult survey population, that has dropped now to $300 in 2009. More are homeless longer, and this is what I was just describing. You can see this line, and I think in many ways this is understandable and makes sense. If we have been able and been more successful through rapid exit programs in getting people out of shelters, and helping those perhaps with fewer barriers to get out, it makes sense that we would have more concentration of people with more distress and potentially more difficulty getting out. And so we have seen this rise up to 52% who have been homeless for at least 1 year. At the same time, we've seen a concomitant decrease in the percentage who have been homeless for less than a month. That is, at the time we interviewed them and we asked them how long they've been homeless, they're saying that they've been homeless for a month or less. And that is only 8% of the current shelter population as interviewed in the 2009 study. If you are homeless for longer, and you go and analyze those characteristics of the individuals who have been homeless longer, you see the things that I know that many of you who have worked in this area for a long time know and expect. Serious mental illness, cognitive disabilities. You know, the traumatic brain injury folks added a question to our survey back in, I think, 2003, related to a 4-symptom checklist to determine whether or not a person had TBI. We were shocked in 2003. We saw the first figures come back, 29% had traumatic brain injury. And you'll see that the third point here, drug and alcohol abuse disorder diagnosis, more likely in folks who have been homeless longer, and chronic health conditions, also more likely for those who have been homeless longer. Increasing use of food stamps. This is the curve. You see back in '91, we were having a high level of food stamp use. Dropped low levels in '97 and 2000, and back up now to 63%. And this is an interesting, this use of food stamps is really not for the purchase of a lot of prepared foods. And so if you're homeless, only certain people who are homeless really can take advantage of prepared foods that you would buy in a supermarket, because you need someplace to prepare it. But still a very high level of use. Other service use also remains high. Clothing shelves, 43%, transportation assistance, and this is often in the form of free bus tokens provided by shelter providers and service providers to help people get around. And hot meal programs and food shelves, still high use for these core services. As I said, we've had the largest growth among the youth population. And in Minnesota, it's a little complicated because technically you become an adult by, in sort of many ways of gauging that when you turn 18. But in fact, federal and state law designates service availability for persons 21 and younger as youth programs. And so we have a little bit of difficulty when we're doing the analysis, separating those 18 to 21-year-olds. They're adults for some analyses and they're youth for other analyses. But for all intents and purposes through state programming, we can consider these 18 to 21-year-olds as youth. This is the largest growth population, 57%. growth from the 2006 to the 2009 study. Shelter capacity for youth relatively unchanged since 2003. I remember advocates, and we have Beth is with us. Back before she worked for the state, she was working in the shelters and helping youth find homes. I remember when we had a really sharp reduction in outreach workers for youth shelters. And we've had a long-term impact from that. We have not really risen back up to be able to provide the level of service for youth who are homeless and on their own. The youngest person that we interviewed this year was 12. I think in the previous survey it was 11. This is a person on their own and homeless. And there are several hundreds of these people. And I think Michelle's estimate for the current year is about 600, 550 to 600 youth on any given night that are in that age range. The youngest, the most vulnerable, 17 down to 10, 11, some as young as 9. Shelter capacity is unchanged. Largest increase in shelter turnaways also occurred among youth. There was a bit of good news here because most of those that said that they had been turned away said that they did find another place to sleep that night. But what we don't know is what was the quality and the safety of that place to sleep. One bit of encouraging news, and I don't know how encouraged to be by it, was a slight drop in the severity level for youth in the study. Slight drop from the 2006 level. So serious mental illness reported by youth went down a few percentage points, down to 46. Out-of-home placements also dropped. The kids that had been in out-of-home placement dropped from 70% to 64%. Kids that reported being physically or sexually abused dropped a little bit, 45% down from 51%. And the numbers who had been sleeping outside dropped from 29% to 24%. Still, even with these drops and some encouragement that perhaps our outreach workers are doing unbelievable work in getting and helping young people find secure and safe places to stay, we still have a significant level of distress in this population.